This presentation highlights the issue of mental health in the East Harlem community, specifically within zip code 10029. This presentation is brought to you by Lab Number 2. According to the NIH, nearly 1 in every 5 adults in the USA live with some form of mental illness. Meet Jay and her family. Jay is very hardworking, and she is a model citizen. She does her best to meet her family's needs. Jay and her family lives in East Harlem. Their zip code is 10029. Jay was recently hospitalized. This was her 5th psychiatric hospitalization since January 2022. According to New York State Department of Mental Health, residents of East Harlem have a psychiatric hospitalization rate that is 3 times higher than the rate of New York City. In Figure 1, from the graph you can see how much larger the number of psychiatric hospitalizations is as compared to that of New York City. You may ask, why is this so? Well, the lack of access to preventative services and early care, greater exposure to economic stressors, and interruptions to health insurance all contribute to these high psychiatric hospitalization rates according to Community Health Profile 2018. Economic stressors. Economic stressors such as poverty and unemployment are very prevalent in the East Harlem community. 23% of East Harlem residents live in poverty, and the rate of unemployment is 11%, according to Community Health Profiles 2018. Studies have shown that residents of areas with high poverty have difficulties accessing quality healthcare and resources that promotes healthy living. Access to healthcare and health insurance. The rate of avoidable hospitalizations, those hospitalizations that could have been prevented if individuals were able to have quality primary care, is more than 2 times higher in East Harlem than it is citywide. It is important to note that individuals who have health insurance are more likely to seek affordable medical care to manage acute and chronic illnesses and thus can live healthy lifestyles. What is one effect of this? Well, the lack of access to resources that supports and maintains healthy living is reflected in the life expectancy of the community. The life expectancy of individuals living in New York City is greater than 80 years, which is greater than the national average. The life expectancy within East Harlem, in zip code 10029, is 3.9 years shorter than the life expectancy of New York City. This is seen on this map. In Figure 2, the neighborhoods that border East Harlem in the southwest direction have life expectancies that are between 83.9 and 85.9 years. Jay and her family's reality. Even though they live in a city where the life expectancy of its residents is higher than the national average, they are not awarded the opportunities and resources they need owing to their zip code. Within their zip code, there is the lack of access to the medical care and to resources that would enable them to live happy, healthy, and longer lives. Unfortunately, this is the reality of many Americans who live in areas with high level of poverty. Your zip code influences your health and the quality of your life. Attached, you can find the glossary along with our sources. If you made it this far, thank you.